Howdy, lieutenants and economists.
The most volatile, evil, disgusting things on the planet, humans. If you have a video request, you can always go to assholeconsulting.com.
Yeah, I am gonna charge you, kids. And that is the importance of not fucking up.
You are such an asshole!
How you kids doing? AssholeConsulting.com. Young man writes, there's a good documentary called A House Divided on the Vice YouTube channel. One of the main things it goes over is healthcare reform. Yeah, Vice, going on... millennial journalism majors, they're going to do an in-depth piece, so I'm a little suspicious. I've worked in healthcare IT for several years, and while that does not make me an expert in how the industry is structured, I have learned some things through observations. It seems a lot of people think there's some easy, relatively straightforward path to healthcare reform, supposedly to a single payer plan, like what the British have. I am not trying to justify one system over another, just trying to point out some differences and am requesting your feedback. The National Healthcare Service of the United Kingdom is one entity. It is the primary healthcare provider for a nation of over 60 million citizens and permanent residents. As an employer, it is one of the single largest organizations in the world, up there with the People's Liberation Army of China. In the United States, there are obviously large participants at the state and local levels, and in the public and private sectors, Cigna, Blue Cross, Aetna, Medicare, Medicaid, and the Veterans Administration, and so on. Even though the NHS is a massive organization, it's just one organization. It strikes me that any attempt to unify or streamline the larger as a percentage of GDP, public sector, private sector, hybrid system here in the United States could feasibly achieve the objective, which is to provide the majority of the uninsured with a useful form of health coverage. And it also strikes me as ignorant when people think that such a change could happen without unwanted secondary effects. The major one would be massive dislocations in the United States workforce. To combine these massive entities in the public and private sectors and at the state and federal levels could force hundreds of thousands, if not millions, of otherwise stable and decent paying healthcare jobs. Could force hundreds, if not out of otherwise stable and decent paying healthcare jobs. I don't care if people lose their jobs. People should lose their jobs. That means the economy is becoming much more efficient in learning to do something better with labor. That's one thing the horse and buggy industry went out. All those guys who were horse farriers went out of business. Who gives a shit? Go work in the auto industry. You don't want a jobs program. You don't. I mean, if we could have computers run everything, like we could have the education system ran by the internet, we could lay off millions of teachers. It'd be great. And then kids wouldn't have to commute. We'd have to lay off all the bus students. I mean, some people would have to stay home and actually take care of their kids. But I'm all for getting rid of labor because it makes things a lot cheaper. Do you agree with this? What's your feedback? Thanks. And please let me know your price for a YouTube publication. Well, you are correct. Well, the problem with healthcare debate and how to form it, there is no one answer fits all because every country is different. A lot of it has to do with maturity of the people. For as much as I give the Scandinavians and the Swiss a lot of guff, they're more mature than your average American. And so they can have things like a socialist healthcare system and national education, college education, bought and paid for. You try it in America or Latin America, it doesn't really work because our populations just aren't mature enough. We'll go major in dumbass shit. We'll eat and pig out and drink. We'll go all eat at the 7-Eleven and then wonder why we're dying earlier. So it's not like, I got the simple solution. But your assessments about national health care and how do you want to pay for health care system, I agree with them. Simply because when I have looked, this is going back several years ago, if you look at a percentage of GDP, The Economist came out with a great chart one time. It broke down the percent of GDP spent on healthcare across all these different countries where the data was available. I forget, blue was private healthcare insurance and red was public healthcare insurance, and they added the two up, and you could see, all right, how much are they spending as a percentage of GDP on healthcare, and what's the distribution between public and private? And if I recall correctly, the United States has a significant, it was like half and half. Switzerland's another example where, yes, there's a public insurance scheme, but you can buy private insurance. And then I think the Norways and the Swedes, they had like, hang on, what's this? There we go. They had nearly all public health care bought and paid for. Now, here in the United States, we're going to talk about the United States, not going to talk about the UK because the United States is different than the UK. I think we have probably the worst of both worlds, the least efficient healthcare system. There are aspects I like about our healthcare system, like the private part where it's like, oh yeah, we can get you in now. I'm amazed by that. I like that. But don't tell me we couldn't do it a hell of a lot cheaper. You look at places, even if they have predominantly a nationalized healthcare system, like Switzerland, it's more efficient. They're not spending as much as a percentage of GDP, life expectancy, other measures. But again, they may wait in lines a little bit more, and Americans could point at that and say, oh my God, look at the lines. It's like, well, yeah, but stop eating shit, and maybe you'll have better health. So if we want to look at it from a purely top-down economic point of view, yes, there is horrific waste, horrific inefficiencies in both the public and private sectors of the American healthcare system. Insurance companies, doctors overprice, hospitals. I remember what was a Band-Aid was like $20. If we wanted to, we could, but we don't want to because we're too lazy. We gotta. Oh, what did Trump say today? Oh, the Russians. Oh my God, we still talking about the Russians? I don't know. But and I'm not a doc like you. You work in IT. I was just an economist that looked at some top-down figures. I don't have the answers. If I were to do it, I'd go in. I'd talk to all the doctors. I'd talk to all the insurance companies, and we'd kind of have this big-ass powwow. And then I'd open up a can of free market whoop ass and say, okay, we're going to do it this way within these guidelines. And yep, you better start bringing down your prices. And then King Clary, not President Clary, King Clary would be like, oh, you're here for some Oxycontin? And come over to this room. What happened to Bob? I don't know what happened to Bob. He came here claiming they needed some Oxycontin. Now he's just gone. Don't know what happened. People that show up at the emergency room because they're pregnant and they're going into birth because they don't have health insurance. What happened to Amy? Don't know. She was here and now she's gone. I don't know where they went. But that doesn't address it. But yeah, I hate to say it because I am a free market economist. Given what we have now, it makes me wonder. I don't know for a fact, but it makes me wonder if just one place nationalized health system, single payer, wouldn't be more efficient. At least from the top-down measurements, measuring it as a percent of GDP, what we spend on healthcare. Right now. Does that mean I'm for nationalized healthcare or single parent? No, because this is where the principle comes in. I'm not responsible for anybody's health insurance except my own, or health in that regard. So we could talk nationalized today. No, you're not responsible for my food. You're not responsible for my lodging. I'm not responsible for your education. I'm not responsible for your health. It's the original flaw, this erroneous premise we operate from, that somehow society owes it to other people to take care of them. Now there can be private charities and it can be, GoFundMe campaigns. I don't care. I mean that's private. But people are just wrong saying somehow somebody else's health is my responsibility. It's not. It's not an opinion. It's not and you could say, well, you should. No, you could say that, but no, I don't have to. You are not entitled to my labor to keep your health up, right? You go get your own damn insurance. You go make sure you don't have kids you can't afford, right? You go make sure you can pay for your health. You go make sure you and again, there can be help. But don't say, Bob Bobson over in Alabama owes me give me debts because I want free health insurance. So yeah, you in general, yes, you are correct. I'm not saying that we should have national health care versus private health care. You are correct in that there is a lot of fat to be trimmed. That if it's going to be a clusterfuck that we have now, maybe single payer is better. Maybe we might want to look at that. I'm just trying to be intellectually honest. But in Cappy's ideal world, you guys, I know it sounds horrible. You don't have the money. I guess you're not getting treated. That's the problem, is that nobody wants to be treated like an adult anymore, and so they're not going to raise up to adult standards. So now we have this increasing and permanent parasitic class. And you go, why is healthcare so expensive? Well, because these dipshits are spending their money on whatever, not health insurance. And they're not even adults. They're never raised to be adults. And then they go, oh, I'm going to go to the emergency room because I'm in labor. Well, shouldn't you have been talking to a doctor before? We can afford that. Well, maybe you should be having kids, huh? I am all for letting people starve and die. I am all for it, because you know what's funny is when people are faced with starvation and death and homelessness, unless you're in Seattle because everyone seems to like it, you will amazingly work very hard to support yourself and become but that's how I became a self-supporting adult. I'm like, do I want to eat? Do I want to pay for tuition? Do I want to starve in a dying cold Minnesota winter without lodging? I'm like, no, I better make sure I got the money. And that's what separates the producers from the parasites, the adults from the children, and everybody else from the millennials. All right. Do you want me to watch a video? Just a response for YouTube and not the video. Okay. All right. There we go. All right. Questions, answers, assholeconsulting.com. We'll see you guys later. Toodles.